How does the difference in increasing the glucose transporters or GLUT4 transporters on the muscle differ when you're doing that high intensity exercise versus more moderate?
Yeah. So for again, I think for a lot of these responses that we might talk about in muscle, that there is evidence to show that certainly high intensity exercise can cause changes in these GLUT4 transporters. We've shown that, including in people with type 2 diabetes, but there's just not the body of evidence that we would like to see to definitively say one is better than the other. We've done a number of studies showing that at least over the short term, more vigorous exercise can elicit superior improvements in some of these markers. But again, the valid criticism is these are relatively short-term studies. They're not always appropriately powered. Many of these, especially our early studies, were what we like to think of as proof of concept or pilot studies. Do these things work? And writ large, we really need these randomized clinical trials to properly investigate all of these questions.
What about insulin sensitivity? Is that also, so there's like you get this glucose transport. That's one way of glucose regulation, and certainly repeated, acute bouts of exercise are probably, you're talking even throughout the day, that would be so beneficial, but also like people are, insulin resistant too.